So for upper eyelid surgery, the way I like to do it is under a general anaesthetic in the operating theatre. Some people do it just under local anaesthetic, but if you're doing a relatively simple procedure, I think that's reasonable. I do one with what's called a tarsal fixation stitch, where it involves a lot of flipping the eyelid backwards and forwards, and I don't think that's something people could tolerate very well without having a general anaesthetic. Mostly I then keep people in hospital overnight, one night. That's just so they're looked up, a bit of TLC and looked after pretty well. They're nursed sitting upright a little bit, and ice packs changed and things which help minimise the bruising. And then if you get a lot of bruising, it prolongs your recovery a little bit. So with getting looked after well in that first 24, 48 hours, majority of people are pretty good with a minimal amount of bruising at about 7 days, and most people, I say, can go out in general public with a little bit of, for females, with a little bit of makeup, certainly within 10 days to 2 weeks, and not be noticed that they've had surgery. And it's really that initial stage of post-operative care. If that's done well and thoroughly, then that minimises that bruising and then therefore speeds up the recovery process. Sometimes you can do it as a day procedure, as long as people have got support at home and have someone to look after them. And then generally they go home. People are a bit variable in how much bruising they get, but mostly it's just a bit of subtle bruising, often descends into the cheek a little bit. Usually at a week, most of that bruising is starting to settle down and change to that slightly yellow sort of hue. And then, as I said, probably within about 2 weeks, most people are pretty good. Certainly for upper eyelid surgery, that you can't tell they've had any surgery done, and can certainly go back to work or interact with people completely in public without anyone suspecting that they've had anything done.